there are several options for treatment for prostate cancer. Radical prostatectomy is one, radiation is another. There's also active surveillance. So, in between active surveillance and treatment, which is either radical prostatectomy or radiation, there's something that's in between. So, for patients who qualify for this, usually patients with lower grade, lower volume disease with a lower risk of having a quickly progressing cancer, prostate cancer, ablative therapy is an option. There's several forms of ablative therapy. Typically, ablative therapy means using a source of energy, either sound wave in the form of heat, freezing, electrical impulses, also somewhat in a form of heat, but more or less electrical impulses to um, to compromise the cell structure, and then but those are the three major form of ablative therapy. Um, Sound wave, there are two types of sound waves. There's HIFU, which is high intensity focused ultrasound, and then there's something called TULSA-PRO. TULSA-PRO is also an ultrasound, but it's a lower frequency of ultrasound, and that's the difference between the two. The other difference between high intensity focused ultrasound and TULSA-PRO is that the energy or the sound wave delivered from HIFU is external through a probe or an ultrasound probe that's in the rectum. The TULSA-PRO is an ultrasound delivered through a probe that goes into the urethra, into the what we call prostate urethra. And then there's NanoKnife. NanoKnife is a electrical disruption of the cell structure to try to kill the cancer cells. So today I'll be going over all four options, and unfortunately, two of those options are not completely FDA approved or recognized by insurance, so they're not available here in the Central New York area, and that is the TULSA-PRO and the NanoKnife. These are available in other areas, in other cities. If you're interested or have the capabilities of going somewhere else, or if your insurance will cover it, or if you prefer to have it be available and are willing to pay out of pocket, those two options are available. I'll be happy to give you and direct you to the places that will be able to provide those two services. But here in Syracuse, we have what we call cryosurgery and HIFU, high intensity focused ultrasound. Cryosurgery has been approved for prostate cancer treatment for many decades now. Typically, it's been approved for what we call a salvage therapy. Salvage therapy is when prostate cancer has been treated with radiation, and over the years, things have gone well, but sometimes after many years after radiation, you can have recurrence of cancer within the prostate. Typically, if there's a recurrence of cancer within the prostate and still localized, meaning it has not metastasized and gone to other parts of the body, one of the options that is very feasible for patients who've had a radiotherapy or radiation to their prostate and has recurrence is to do what's called a salvage cryoablation. Salvage cryoablation is the concept of which I place needles within the prostate. It may be the whole prostate, half the prostate, or part of the prostate, depending on where the cancer and how much you want to treat. And each of those needles form an ice ball or an ice core. It's not really a ball, it's actually a cylindrical core. And using argon and helium gas through what's called a Thomson reaction, where the gas is going from a liquid to a gas form, And basically, what gas to liquid form, what it causes is an ice rod to be produced on the needle. The ice rod goes down to about -40 degrees, which would then be able to kill any cell structure. And this procedure is done under anesthesia. Usually, it is a 1 to 2 hour procedure. Patients are usually able to go home the same day. Most patients would have to have a catheter in after the procedure to help the bladder empty. Some patients are able to not have a catheter, but the majority of patients after anesthesia and after the procedure may need to have a catheter placed so that their bladder can drain, because even if we give them a chance to urinate, they may not be able to urinate right after the surgery. The procedure is done under general anesthesia, where you're put to sleep so you don't move. Very similar to a biopsy, but it's a transperineal approach, meaning what we do is that put an ultrasound in the rectum to help image and guide the needle. And we put the needle in the perineum. The perineum is an area between the rectum and the scrotum, and the needles will go into the prostate. Depending on how big the prostate is and how much of the prostate that needs to be treated, you may need 1, 2, up to 8 different needles of different length and sizes to create these ice rods. Needles nowadays are able to either make a long ice rod or a short ice rod to pinpoint the treatment area. Cryoablation, as I said, has been used for salvage therapy, which is to treat recurrence of prostate cancer after radiation. But cryosurgery can also be used as a primary treatment, meaning if someone has Gleason score 6 or 7 prostate cancer with a couple areas that have been proven to be the exact areas of which the cancer is, something that can be seen on an MRI or biopsies, after biopsy showing that the cancer is in one area, you could do a focal treatment in which you can treat just the area where the cancer is seen and has been proven. Other times you can treat a whole half of the prostate. Some people who have had prostate cancer where it's only on one side, either the left or right side, and you treat just one side. And some people may need focal or multiple areas of which you need to treat, because the cancer is located in multiple areas of the prostate. So you put the needle in to in the prostate, depending on where you want to treat. Then you freeze the prostate, and then you thaw it, and then you freeze and thaw. So you need 2 cycles of freezing and thawing. That typically takes about an hour and a half to 2 hours to perform the surgery. The great thing about freezing the prostate is that there's minimal bleeding and there's minimal pain because you're freezing the area. Once the patient wakes up from a cryosurgery or a cryoablation of the prostate, they typically don't have a lot of pain. There may be some irritation, very similar to the irritation you've had when you went through the biopsy. You may see a little blood in the urine. You may feel like you need to urinate, and sometimes you feel like you need to have a bowel movement. That's a very short-lived symptoms. Typically takes about a few hours for it to go away. Most patients have no pain or very minimal pain, similar to a biopsy. The effectiveness of cryoablation depends on the type of cancer, how much cancer, and what type of surgery. Either focal, where you're only doing a few spots, or you're doing a hemi, which means you're doing the whole left or right side, or you're doing the whole prostate. So it all depends. But on average, the effectiveness of cryosurgery has been proven to be well over 70 to 80% overall, and has been very well tolerated. The good thing about cryosurgery is that it does have a much higher preservation of erectile function and continence compared to surgery. Definitely much better than what we call a salvage prostatectomy, which means to remove the prostate after radiation. Once you've had radiation and you are to and you have a recurrence of cancer and you have to have either surgery to remove the prostate or cryosurgery to eliminate that recurrence of cancer, hands down, cryosurgery has less comorbidity than removing the prostate, meaning it's better tolerated, less blood loss, very minimal. It's an outpatient procedure, so you don't need to be hospitalized. Recovery is much quicker than a salvage prostatectomy, and also the preservation of erectile function and urinary continence is much better with salvage cryosurgery than salvage prostatectomy. High intensity focused ultrasound, again, can be used for either salvage therapy or salvage therapy after radiotherapy, or as a primary treatment for prostate cancer. Again, HIFU or high intensity focused ultrasound can be performed focally in certain parts of the prostate, or one half or the other half of the prostate, or both parts of the prostate. Overall, the limitations of high intensity focused ultrasound is the amount of cancer, the degree of cancer, and also the size of the prostate. Typically, a good candidate for high intensity focused ultrasound is a smaller prostate that's less than 40 or 50 cubic centimeters or grams. The smaller the prostate, the better. The reason why is that the sound waves, as you can imagine, sound waves through a very thick amount of tissue doesn't have as much effectiveness as a sound wave going through a less dense or a less thick tissue. Typically, I would prefer and recommend HIFU and for a smaller prostates as opposed to a larger prostate. I think larger prostates are better served for cryosurgery. HIFU, as I said, is very similar to a prostate biopsy, except for there's no invasive portion to it, meaning we're not introducing a needle, we're not taking out tissue. All we're doing is putting an ultrasound into the rectum and then targeting and activating and targeting the sound waves towards portions of the prostate of which the sound wave would be delivered at high frequency. That would generate heat. Heat would then destroy the cells. Procedure usually takes about an hour to 2 hours, depending on how big the prostate, how much we're treating. The patient will have to be under general anesthesia because we don't want the patient to be moving, and you need to have very precise targeting. There's minimal pain from this procedure, very similar to a biopsy, and most patients are able to go home within a few hours after the surgery, and recovery is fairly quick. Some patients may need to have a catheter in after the procedure because they're not able to urinate. Two reasons why. Sometimes general anesthesia itself puts a person at a higher risk of not being able to urinate after anesthesia, and also the inflammation or the edema, the swelling that can occur after treatment with HIFU. The effectiveness of HIFU is has been very effective for patients with a recurrence of cancer. So we're doing a salvage HIFU or high intensity ultrasound. As for primary treatment, that has also been shown to be very effective. There are 5 and 10 year data showing that it has been quite effective for specifically low grade, low volume, or intermediate grade cancer. It's not effective for high grade, high volume cancer. It's actually not recommended, neither cryoablation or HIFU as a primary treatment for high grade, high volume cancer.